It's now March 18th at about 8:30 p.m. Healthline called us maybe about an hour ago to see if we needed help with anything. Finance, food, that kind of thing. And I was surprised. I hadn't expected that. Pleasantly surprised. So why were Healthline here in New Zealand ringing me at 7:30 on a weeknight to see how I was, how we all were? Let me take you back a day. Our 2-year-old and 7-month-old came back from a cafe yesterday afternoon with my wife. They'd been to see one of my wife's old work colleagues. Now, Miss 7 months had been a bit grizzly for a couple of days, and we had no reason to think it was anything other than teething. But Miss 2 was looking pretty glum and was saying that she had a sore throat and she was burning hot. She managed to have a little something to eat and then had a disturbed night, but did sleep. She woke in the morning and I went to get her from her cot and she was burning hot. I thought maybe it was the cover, so I changed her nappy and had her clothes stripped off for a few minutes. She was still burning hot. We got ourselves together and my wife called the GP. The verdict was that we should come in for testing for COVID-19. You see, both my wife and I had slight sore throats over the last week or so, but we just put it down to the cooler air at night. That's what normally happens at this time of year. But my wife's asthma had got worse over the past couple of days too. And we'd also had a visitor from Melbourne at the house 8 days ago. He didn't have any symptoms and he still doesn't, but I think it was enough for the GP to suggest that we get tested. Now, let me be clear, we didn't push for it. It was a recommendation by the health professionals at the GP clinic. I'm not even a patient at that clinic, and they just made it easy for us all to go in and get it done there. So early this afternoon, we turned up in a clinic car park and were greeted by a GP in what was the equivalent of a hazmat suit. Understandably so, because he was swabbing for me and my wife. Swabs for 2 of our girls too. Miss 9 hadn't been at our place for 5 days, and the advice was that if she wasn't symptomatic by now, then she was probably okay and was unnecessary to take any action. Now, I'm going to take a moment out right now and tell you just what I was thinking. You see, I'm a clinical psychologist who's worked in disaster recovery and response for over 15 years. I've worked on pandemic influenza plans in both the UK and New Zealand, leading the authoring of major parts of both of these plans. Can you imagine what was going on in my head? Are you kidding me? We can't be the cases that prove that community transmission of COVID-19 is going on in New Zealand. The irony. But no, that's not right. We had a guest over from Australia. Oh, well, you didn't think that through very well, did you? Right, what do we need to do now? Who do we need to tell? And what do we tell them? Because, well, there's nothing to tell at the moment, really, apart from, well, we aren't feeling 100% and everyone is being cautious and they're testing us just in case. Oh, heck, I'm going to have to tell my mum and dad. How are they going to take it? They're already in lockdown in London, and it's already looking pretty unlikely that our trip to go and see them in London is going to do anything other than making them miss us more. Why the heck is this happening to us? Why is this happening to anyone? Only it was a lot more sweary than this, and I had an alternate track going on in my head too, a bit like this. Okay, this is going to be unpleasant, but at least we are getting tested. That's a lot more than what's going on in some other places right now. And maybe life won't be that different. I've been working from home for 18 months. We have 2 small and 1 medium-sized kid. It's not like we have a social life we're going to miss. I'm a bit worried about my wife's asthma though. And why is my forehead cold and clammy? I think I'm making things up. Oh, she really isn't going to like that swab up her nose right now. And so here we are. It's just gone 8:30 p.m. on Wednesday, 18th of March. Life goes on. We wait. We'll see what the night brings. Hopefully it'll bring sleep and we see how we are in the morning. To everyone we may have been in contact with over these past few days, I'm sorry. Not because we didn't do what we were supposed to do, because we did. I think we've told all the people that need to know at this point. There may be more people we need to tell once we get the result on Friday or over the weekend. We'll do what we need to do. But I'm sorry that the random roulette wheel of our life has pushed COVID-19 into our path, and perhaps there is a small chance it may have ricocheted into your path too. There is only a small chance that any one of us is going to test positive for COVID-19. We'll see what's going on in the morning. Wish us luck. All right, it is Thursday, 19th of March. It is 6:30 a.m. I am out with the dog for a walk. There's no one around, so that's good. I can maintain my physical distancing and I feel fine. My sore throat that I've had for the last few days has disappeared. There weren't any disasters with the kids. Overnight, everything seems to be okay. So we'll just have to wait and see when everybody's woken up properly. But that's just a little bit of an update. I'm feeling all right. Dog's taking a crap. I better go and clean it up. Later. It is Thursday, March 19th, about 4 p.m. in the afternoon now, and we've had it confirmed that my youngest daughter and my wife have tested negative for COVID-19. We've had the appropriate advice about what that means for continued isolation, so we are clear that my wife and Miss 7 months need to stay at home until at least 48 hours after their last symptoms. Now, we're still waiting for results for me and Miss 2. For some reason, the 2 samples got processed in one set of testing and the outstanding 2 samples somehow got separated, and we probably won't get those results now until tomorrow. It's not ideal, but it is what it is, so we'll just have to roll with that for now. So I haven't really had any symptoms today at all. The headache I had yesterday has gone, and actually looking back on it, I actually think it was caffeine withdrawal. With one thing and another going on, I only had 1 coffee yesterday, which was really early in the morning, and when I would normally have 2 or 3. That's my explanation anyway, and I'm sticking to it. The GP seemed convinced anyway. So if this continues, then because I will have been symptom-free for 24 hours, if my result comes back tomorrow, I am cleared to go out and get supplies. Not to muck around and hang out in a coffee shop or anything, but I can get vital supplies in. So that's good because baby food, formula, nappies, those kinds of things. Oh, and yeah, coffee for home too. Right, I'll keep you posted. Hopefully tomorrow is the last segment in this little episode. See you in the morning. All right, it is 10 o'clock at night on Thursday, 19th of March, and I have just got a text message from the doctor saying that I have tested negative for COVID-19, which is good news, but unfortunately we're still waiting for the result for my daughter, Miss 2, who was probably the illest of us all when she suddenly took a downward turn on Tuesday. So just waiting for that now. So yeah, 3 out of 4, and yeah, we'll sleep on it, and I will tell you when we find out sometime tomorrow. Good night, and I hope you're well. Keep safe. It is 6:30 a.m. on Friday the 20th of March, and it's been a relatively peaceful night. The girls seem to be okay, my wife seems to be okay. So yeah, we're just waiting now for one more result for Miss 2, and then hopefully we'll have the all clear. Yeah, we'll do what we need to do in terms of keeping ourselves apart for a little while until we've reached the required time after symptoms started and then disappeared, but fingers crossed. I'll update you later. Right, where's the dog gone? There he is. See ya. It's 10 a.m. on Friday, March 19th, and I have just found out that Miss 2 is also negative for COVID-19, which is a relief, I can tell you. But I have been thinking about what I've learned from these last 3 days that I can share with you. Firstly, at times this has felt a bit like an out-of-body experience. I've almost felt a bit apart from it, as if I was watching all this happen to someone else, especially when the GP came out into the car park dressed in so much protective clothing. I understand why he did that, but don't underestimate the impact that it can have on you. Suddenly it all seemed pretty serious, and when things get serious, your mind can flick into what's called dissociation. Now, dissociation refers to being disconnected from the present moment. It's a subconscious way of coping and avoiding a traumatic situation or negative thoughts. And I think that is what was going on for me. It's a protective mechanism that helped me to get through that moment. Of course, if it's going to go on all the time, then it's more of a worry. But for those few moments, I think it enabled me to just do what I had to do to help get the family through the testing process. The swab on your throat and then through your nose to the back of your throat isn't particularly pleasant, and Miss 2 was quite upset by it all. So dissociation works to get you through the short term, but if it's something you find yourself doing all the time, try to get more information about it and or talk to a mental health professional. In fact, if you feel like any of this is getting on top of you, or if you feel paralyzed by fear, anxiety or worry, then don't be afraid to reach out. The second thing I learned was that the testing process that we experienced worked pretty well. From trying to get advice to booking the testing to actually having the test to the follow-up from the National Healthline Service where we first sought advice, through to my records being available at my GP even though my testing happened at another clinic. To be honest, I was surprised. I expected glitches, but it worked well, and I hope that this is the experience that everyone gets. And lastly, I know that we still need to be vigilant. A negative test isn't a free pass. It could mean several things, which is why we will still continue to be careful about contact and follow the advice we've been given. There's no way of knowing right now if we have had the virus, but it's passed through us now and is at undetectable levels, or if it means that we never had it in the first place. Now, it's much more likely to be the latter of those two options given all factors considered, and especially that there is no community transmission detected yet here in New Zealand. But I know that work is happening right now to develop a blood test to detect antibodies showing that you may have been infected at some point with that virus. And this will be a vital tool in helping to manage this outbreak. So we will keep washing our hands and following all the advice to keep us and our community safe. Hey, I hope you found this video useful. Stay safe, stay well, and remember to stay socially connected even if you have to be physically apart. Go well.